Welcome, everyone, to Wellness Wednesday with 3W. I'm your host, Helen Nguyen, CEO of 3W Medical for Women. We are a nonprofit health clinic out here in Seattle, Washington. And today we have our special guest, who's always, I love sitting down with her, is Dr. Rutherford, who's our president and medical director. And what are we going to be talking about today, Sue?
So we're going to be talking about health insurance and challenges with health insurance.
Mm-hmm.
Yes.
We've seen our fair share of patients.
As you know, Helen, almost half of our patients have no health insurance.
Yes.
And that's one reason we're kind of a safety net in some ways, because we are a very inexpensive or free sometimes for many of their appointments, place to come. Like the gal that came in today, she actually had insurance, but last minute, within 30 minutes, I'm really worried my IUD is in the wrong place. Oh. And so we popped her in and added her in, checked to make sure, it's okay, and out the door. So
that's awesome.
So
that's
it's
amazing.
Nice to be able to help people quickly.
Absolutely.
With low cost,
Yeah, without a price tag attached to it.
Yes. I think that calls to my mind the challenges that our system has. And of course, everybody complains about it. And I have a friend in Canada who says that it's so much better there because they end up not losing their house and all of that because of the costs. And there certainly are issues for people with extremely high cost issues, for cancer or major trauma or things like that, big surgeries. But, when things are kind of routine, you want to be able to get in quickly. And we just don't have that marketplace-friendly type of system for the most part right now. And people don't know how much it's going to cost or, it's a challenge.
Well, it's very hard to navigate the medical system right now in general.
It really is. This ends up becoming part of what we help people with, actually, is recommendations on how they can go about getting the help they need.
Right.
Because we can only provide a little tiny slice of that. But
yes, but we've become a very essential resource.
Yes,
in this community.
Absolutely. So, one of the challenges is that most health insurance is still sponsored by employers, and that dates back to World War II. The tax difference. So employers got to deduct from their taxes or, their tax obligation, this cost of insurance for their employees, but an individual can't take it off their individual taxes. And there's some exception if you're self-employed, but if you work for a small business, many small businesses can't afford the huge price tags for health insurance for their employees. So, people are making money, but they don't have health insurance. It's a big problem. Yeah, the Affordable Care Act was supposed to solve some of these problems, but instead the privately purchased insurance market just dissolved, went away, and insurance became more expensive for both individuals and employers. Yeah. And the plans became more restrictive, so you couldn't keep your doctor, and there are only certain doctors, providers, or hospitals that you can use. Right. And you can't figure that always out ahead of time. It's really tough.
Yes.
Even for people that have employee health insurance, it costs an arm and a leg to add in other family members.
Yes, it does. And just the headache of knowing insurance have their own language.
Yes.
That is difficult to navigate. Yes. And I just think about my parents who are, not fluent in English. And I just think of folks like that who, where do you even start? Especially, and then now we add in, we see patients that are pregnant and are needing insurance. The complexity continues to build.
Yes. I mean, some things you can put off a bit. We probably all put off some things, even if we can afford them.
Yes.
But pregnancy, once it's started, you can't delay.
Yes.
Wait a couple months till you get on insurance and then restart. Yeah. So brings to mind a couple of patients that came in who had jobs. So one was a waitress, one was a hairdresser. At the time, they both made too much money to qualify for Medicaid, to qualify for Apple Health. Yeah. And so they had to decrease their income, decrease their hours and everything for 2 months. So they had 2 months worth of income that met the criterion before they got into health insurance. And And they had some medical issues, and they really needed to get started right away, but the cost was prohibitive. So that's, the safety net has some huge holes in it.
Yeah.
Yeah.
And we're seeing that more and more, correct?
Yes,
Okay.
we are seeing that a lot.
Yeah.
So COVID didn't help.
No, it did not.
Yeah. So I would like people to consider several things when they're thinking about how to pay for their health care, particularly regarding insurance.
Okay.
First one is, can you get on the insurance plan of a family member, like the employer's health plan or something like that? Even though it's very expensive, if you're looking at a possibility of facing some big expenses, like what happens with pregnancy and delivery. Pregnancy expenses, if you have complications, those can be
so
huge.
Expensive.
Yeah, those can be huge. So, it may be worth it. If you're just signing up on your own for health insurance, it's a problem because now you've got a pre-existing condition. If you're signing up to be on a family member's employer-sponsored plan, oftentimes it doesn't matter if you already have something or not. You get on the plan.
Okay.
And you get covered. So if you're pregnant or if you're going to need some certain types of health care or something, you're not eliminated because of your pre-existing conditions.
Okay.
So there are some alternatives to health insurance that are considered acceptable for the federal mandate, and those are cost sharing programs.
Oh yes,
like
I
the
love
Christian,
those.
yes,
Like
the Christian cost sharing ministries, health ministries,
where
where people pay an amount. It's not health insurance, but everybody pays in, and then the cost is spread out, and they they adjust as needed. Usually on an annual basis as to what people's cost sharing will be, and then sometimes there are costs that you're asked to donate. To a fund that helps cover people's costs that isn't covered. But I do know for those that if you're pregnant, you cannot sign up and have your pregnancy covered if you're already pregnant.
That's good to know.
Yes. So people can't delay because it's too expensive. Oh, now I'm pregnant, I'm going to need it, and then sign up for that and get it covered.
Yeah.
So...
Well, the good part about that is it's nice to know where your money is going, because they usually tell you your... payment.
It doesn't cover routine things.
Yes.
Doesn't cover like preventive care.
Yeah.
That's out of pocket.
Yes.
But that gives you a chance to budget for it. And for many people, the cost of doing it that way is cheaper than the regular insurance.
Well, I just liked it because it always told me where the extra donation went or where my membership went.
Yes.
Like Pam in Idaho just got her hip replaced. Thanks, Helen. Thanks for that contribution. And that's just nice to know that your money is going towards someone that really needed it.
Yes.
It makes it more personal.
Yes. And not just the cost of running the company and the profit for the
shareholders.
Exactly. Yeah. So another thing to consider is, what time of year is it? Which is basically because I think this system evolved because they're trying to make sure that people don't just say, oh, it looks like I might need a gallbladder out, I'm getting some symptoms or whatever. I'll sign up for my health insurance to start next month and then I'll have my surgery. Okay. So you have to sign up, be paying into the pool so that it's truly spread evenly, not just sign up for a few months to cover your really expensive thing, take all the money out and not pay anything in.
Right.
So you have to sign up usually in November, December. They call it open enrollment.
Open enrollment.
Yes.
Okay.
So that most of the health plans have that, including Medicare.
Okay.
It's open enrollment. That's when you can change plans, et cetera. Sometimes that open enrollment closes before the middle of December. Okay. Sometimes it goes to the end of the month. Sometimes it includes part of November. Each situation is different. But just think, hit November, it's like, if I don't have health insurance, I better look right now and see what I can get.
Is that easy to navigate? I'm assuming everything's online now.
So now, yes, everything's online. Apple Health, in fact, they've done away with their paper brochures. So, so we can't look at something easily and say, oh, this is what it would cost you. But oh, well. Yeah. Yes, and in the state of Washington, they have what's called the Health Plan Finder.
Okay.
And so if you Google Washington State Health Plan Finder, you can also get phone numbers. So if you have trouble navigating computer things, there's phone numbers there that that website will give you.
Sure.
In order to call. And we give patients a handout that also has the phone numbers.
Awesome.
So that if they're not comfortable using the computer, or most of our patients are very comfortable because they're in that age range. But
they probably prefer it.
Yeah, probably prefer it. But some people have just done it by phone. And one of our patients a few weeks ago had just done it by phone. So,
okay. Do you know if they have translators for those that don't speak Spanish or English?
Yes.
Okay.
They have all sorts of different translators.
Oh, perfect.
Yes.
That makes it very accessible then.
It really is. It really is accessible. And it lets you basically shop for plans. One piece of information that you need to know to go on this is your monthly income. Okay. Because that's the question that you'll be asked. Okay. Is what is your monthly income? Okay. And depending on that, it'll bring up the smorgasbord of choices that you have. So it will, if your monthly income is below a certain level, it will also ask you questions about how many people in your household. Okay. So for example, if you're a single woman and you're pregnant, that's actually 2 people in the household. It's considered 2 persons.
That's awesome.
Isn't that interesting?
That is
so
interesting.
So if you just have the positive pregnancy test and that's all we've got so far to confirm it. Right. And you're going to sign up for Apple Health, you count as 2 persons. It's interesting that they're calling that baby. Yes. As soon as you got the positive pregnancy test, they're calling that a person. That's our state. Yeah. I kind of like that, frankly.
I do too. But so if patients are wondering if they're pregnant and they need to, it's November, they need to figure this stuff out, they can come in.
Oh yeah, anytime. So that's one thing is Apple Health for pregnancy. I think Apple Health in general, there's no special
rolling enrollment.
Yes, it's enrollment all the time. Okay. If you qualify, you can sign up. Oh. Again, because the income qualification is so stringent. For example, people that lost their jobs in March because of COVID. Yeah, they very quickly qualified for Apple Health because they had no income. Okay. Yeah. So Apple Health is anytime, but all the other insurances are run through commercial insurance companies. Okay. And they are the ones with the open enrollment.
Okay. Why is it so important for patients who are pregnant to be on some sort of insurance?
Well, first of all, if they're on Apple Health, everything's covered. They don't have co-pays. Everything. So
is the quality of their care
absolutely
less than those that can pay?
Not at all. Okay. Not at all. Yeah. In fact, as a doctor, seeing somebody on Medicaid for years, it was kind of like a breath of fresh air, to be frank, because it was like I just did what I needed to do and didn't worry about it. Didn't worry about the patient getting stuck with the bill. Now, sometimes we might eat it. They might not pay us. Yes. But I knew at least that the patient wasn't going to get stuck with a huge bill. So
that's actually a really good way of looking at it.
I mean, it'd be nice to get paid for what I did too. Yeah. But at the least, the patient wasn't going to be really harmed. Most of the commercial insurance, you don't have to worry. There are some things, though, they keep wanting to pre-authorize. Okay. I don't know why they bother, because if you're really doing the right thing. It's got to be pre-authorized, right? Because it's the right thing to do, and it's just costing more to the system. But anyway, that's another story. Yeah. So we've talked about signing up, going to the health plan finder. One suggestion I have is if you haven't signed up for, say, you're pregnant and you have that you're going to qualify for Apple Health, sign up for that. Then, and you want to go to a certain hospital or a certain doctor's office or group or something like that, then I would call that group before you actually sign up on the website and say, okay, I'm pregnant and I'm going to be signing up for Apple Health. Yeah. I expect to qualify. What plans do you recommend? Yes. Because there are situations where the doctor's group, if they're not affiliated with the hospital, they may take the insurance, but the hospital, for some things, might not be on some insurance plans. It's more of a problem when you're not pregnant. Okay. That's the case. Yeah. So, but if there's a place you want to go, people you want to see, check with that group, check with those people to see, hey, what insurance do you recommend that I look for? Because I want to come see you.
Right.
and then sign up. It can be hard to change after you've signed up. But that may require that's what changing insurance. For instance, Apple Health changing insurance, that's when there's sort of an open enrollment.
Okay.
You can't just change anytime.
Yeah.
Yeah.
Well, that's so important that you're helping patients, encouraging them to do their research, to be an advocate for themselves before signing up for something that can seem a little daunting to a lot of people. You know, you talk about insurance and you don't know where to start.
Yeah.
And it's been really wonderful to be able to hear the conversations that you're having with patients here at 3W and saying, you know, this is how you're supposed to do it. It's okay. I've even seen you stand next to a patient while she made the phone call, right?
Yes, and recently I got on the computer with a patient because at a previous appointment I told her, this is your homework. You have to go on. You know, you're unemployed. You have to go on and sign up for Apple Health.
Right.
Here's the phone number. If you want to call them, do it. But she was having some struggles.
Yeah.
And so she came back a little bit later because I needed to it was follow-up of something.
Yeah.
A cyst or something like that. And I wanted to make sure there weren't big problems in the meantime until she could get care through insurance and go further. She might need surgery, for example. So she came back and I said, well, have you signed up for your insurance? No. And I'm having trouble motivating myself, basically, is what she was saying.
Yeah.
I said, okay, get off that chair, come to the desk. The nurse's station in the clinic.
Yeah.
We got on the computer.
Yeah.
And I said, okay, you're going to sign up.
Yeah.
Okay. Username, password. We went through the whole thing. She got insurance. Well, the thing was I had a place I already wanted to send her because I was worried she might need surgery.
Yeah.
So I called them at the same time and I said, hey, I've got a patient. Well, we're in this situation and we take this insurance, but we don't take that insurance. Maybe I'm getting two patients confused, but there was one where I got on the phone and said, hey, I want to send you this patient. Well, what kind of insurance does she have? Well, she has this. Well, the people that we use for doing our MRIs or the operating room, that hospital doesn't take that variety of Apple Health. It takes this other variety of Apple Health. I said, okay, I'll either send someplace else or we'll work on this. So we got on the computer and we got her signed up, and it was this fall, so it was easy. She was able to switch.
That's
effective
awesome.
January 1st. I said, that's great.
Wow.
Then call and get an appointment for January 2nd. Or, well, I guess that wouldn't be true. Maybe the 4th. That was yesterday. That'd be the first working day after New Year's.
Yeah.
So I said, because you'll have the right insurance.
Yeah. That's amazing. That's amazing how much you care for the patients that come here and truly being their social worker, being their case manager, going above and beyond your role.
Well, that's a compliment coming from a social worker.
Well, I just remember, having to be a case manager for my clients and navigating through that system. It's tricky.
It is tricky.
And I can totally sympathize with patients that are like, this is too daunting. It's too overwhelming. I don't know what to do. And we're so lucky that you're passionate about our patients getting their insurance because it's ongoing care that they're going to need.
Yes,
it's a safety net that they need.
Now, one additional safety net is we can do the very limited, we have no after hours, no emergency care.
Yeah.
In fact, somebody calls in having pain and bleeding and they're pregnant. It's like,
emergency
don't
room.
come here. Yes, because if you come here, I'll be able to look at you and say, yeah, you're at risk. Go to the emergency room.
And
that's about all I can say. It delays their care. That's right.
Yeah.
But for those that aren't having those problems, but they're having trouble getting in, I remember before COVID, it was sometime, I had a patient that they said they couldn't see her for 8 weeks. This was an OBGYN clinic.
Yeah.
She was pregnant. It's like, wait a second, she'll be like 12 or 14 weeks or something by then. This doesn't make sense.
Right.
So I said, okay, come back here. Let's do your prenatal checkups.
Yes.
So we did the very simple, basic prenatal checkups and confirmed, the heartbeat's still there and all that, which is a lot of reassurance for people.
Yes.
And yes, you probably don't need to be checked that often during pregnancy all the time, but people worry.
Yes.
So
especially if it's their first pregnancy.
Or they've had problems before, like miscarriages. Yeah, it's really important to make sure that, and some offices have had difficulties getting people in quickly because of the COVID situation. They've been reluctant and,
Right.
Yeah. Anyway, so I think people should be seen quickly and easily, and we can provide that service. We don't have the medical liability insurance to cover all the sophisticated OB care.
Yes.
So we don't do the detailed pregnancy ultrasounds. There's we don't do a lot of prescribing.
Yes.
Just the very basic stuff. Iron for anemia, sure. A few labs, we can order a few labs.
Right.
Things like that. But at least we can provide some sort of safety net while they're waiting to get into their OB care.
Sure. And that safety net is huge, especially for those that are patients that are low income, again, patients that are undocumented, patients that feel like they have no place to go. We've become that resource for them, and what a privilege it is to be that resource. And you just take such good care of our patients. We never have a complaint. So
I don't know about never, but it's pretty close to never.
It's hard to find. It's very, very, very difficult to find.
I do want to say something else for people in general that need maybe primary care, because we don't do primary care. And if they don't have insurance. So there are some alternatives. The federal government does what they call federally qualified health centers.
Okay.
And there are a number of those in the region. They're scattered all over the place. It includes public health, but includes a variety of different places: Health Point, Neighbor Care, Country Doctor, places like that.
Okay.
And they do sliding scale. So they get subsidized with government dollars in order that when somebody comes in who's low income, they get the income information, and they can say, because your income is this amount, your cost will be 50% of the charge, or this many dollars, or zero, that sort of thing. So they can adjust it. It's called sliding scale.
Yeah.
The other thing is there's a health clinic that has a mobile unit, and it also has a fixed place, and it has a dental clinic, and it's called Lehigh. Yeah, and they ask people for $10 donations. Patients do have to qualify as low income.
Okay.
But very generously, one of our local hospitals is providing free labs and imaging.
Wow.
Yeah, for people from this clinic. Again, they know they've already qualified through this clinic in their process of doing that. So that saves the hospital a lot of money, actually.
Yeah.
But to do that, but so that's a place to go. So people without insurance do have ways of getting some care. There are other few free things around too. Especially, we deal a lot with STIs, and there are a few places you can go to also get some free care for that.
For STIs, I remember you sending folks to Harborview.
Yes, that's the King County Public Health STI clinic. And then there's a place on Aurora. I've driven by it. Can't remember the name.
I can't remember the name.
Anyway, but there's a place on Aurora, and I think there's a place on Capitol Hill, and those are nonprofits. Those two.
Yeah, and if Lauren, our office manager, does such a good job, if we can't get you in for STI testing and treatment immediately because we're booked for the week, she is such a good resource because she never says, well, we can't scoot you in, so bye. She always goes, well, these are these other places that we can refer you to.
Yes.
And if you have any questions, please feel free to give us a call and talk to Lauren. She has a list of resources that she can refer you to if we can't get you in immediately.
We actually offer that list because people may know someone. They may have insurance, or they may be okay, but they may have a friend or neighbor or somebody that's struggling. And so we actually are giving this handout to every single patient of referrals for care that we don't provide. And it's both OBGYN related care and this low cost care.
Yeah, we truly fall under that definition of comprehensive health care because we are providing care. If we can't provide it here, we will send you or refer you somewhere else that can take care of you.
Yes. We can point. We've got the road signs to send you a variety of different places to get the help that you're looking for.
Yes. And what makes us unique, I think, being a patient here myself, is that if you have any questions, if you are intimidated about going somewhere else, Dr. Rutherford, Christy, any of our medical providers are so quick to help you become your best health advocate. I think that's so...
Yeah, that's part of the coaching.
Yeah.
This is what you tell them when you phone.
Exactly.
Tell them you have such and such. I even write it out for them. Tell them this is what you need. I need a colposcopy. Here's how you spell it. Yes.
Yeah. And really, because you only get, only at 3W that I know of that you get a full hour of unrushed care. Anywhere else, you're pretty much in and out. And you want to be able to really get to the heart of your problem.
Right.
And it's intimidating sometimes to sit in front of a medical provider and not know what to say, not know where to go. So it's so important that I feel empowered when I go somewhere else to say, no, this is actually what I want.
Yeah.
And this is how I'm going to say it in your medical terms that you folks know so well. So thank you again for covering this. It makes me as a social worker, like you said, so happy to know that we're providing this a little bit extra layer of care for our patients that they're not going to get somewhere else. Truly unrushed care, truly just looking out for the person in front of us, that they get the best healthcare for themselves. So thank you again, Sue. Thank you for all that you do.
It's fun to practice medicine this way, I have to admit. It's a lot of fun.
Yeah, it looks like it. So for those of you listening, if you have any more questions about what we do, how we help folks, or if you're curious about how to get onto Outbill Health yourself, please give us a call and let us try to help you. If you're pregnant and are unsure about what's ahead, what are the steps ahead for how you're going to pay for everything, please reach out to us. Please make an appointment so we can help and assist you and partner with you in your care. So until next time, be well, and thank you so much for tuning in.